County Health Department. Today we have with us Nita Ludwig of the Rock Island County Health Department, Ed Rivers of Scott County Health Department, and Brooke Hendrickx of the Child Abuse Council. All of them will have prepared statements, and then we'll take your questions afterward. As always, we ask you to direct the question in the chat box to the person you want the answer from, and Brooke Barnes of the Scott County Health Department will moderate the question and answer section. Nita, start us off with Rock Island County's numbers, please.
So for today, Rock Island County Health Department has 17 newly reported cases of COVID-19. That brings our total of positive cases in Rock Island County to 587. And we are still, we remain at 18 deaths for Rock Island County. All the cases today are isolating at home.
In Scott County, we stand at 286 cases. Since we last spoke, there have been 2 on Friday, 3 on Saturday, 1 on Sunday, and 6 today. The number of deaths stands at 8. So as we anticipate entering a new phase of the COVID-19 pandemic in Scott County, with the potential opening of more businesses, according to the governor's announcement today, retail establishments and other buildings in the upcoming days and weeks, we know that individuals may begin to feel the pressure of having to make personal decisions on when they're ready to begin going out and about. These decisions are difficult because there's no right answer, and there's no one-size-fits-all answer for everyone in our community. We again encourage you to ask yourselves a series of questions. They may help you think through your decision to go out and about and make the safest choice possible. Regarding illness, do you have any symptoms that suggest that you're ill? Regarding being at risk, do I have any underlying health conditions that put me more at risk should I come into contact with someone who has the virus? Necessity. Is this a necessary trip for myself or my family? Social distancing. Will I be able to keep at least 6 feet of physical distance between myself and others while I'm out? And hand hygiene. Will I be able to keep my hands clean while I'm out? Remember, we're still in a pandemic where the virus is circulating in our community. We need to make smart, careful decisions on why we go out, when we make trips, or how we protect ourselves and other members of our community. A note about Test Iowa. All Iowans are encouraged to complete the assessment at www.testiowa.com. The site has opened today in Davenport, and individuals will begin to be able to be tested there by appointment only. Additional questions can be answered by the Iowa Governor's Office, which is coordinating the sites statewide. Janet?
Okay, next we'll hear from Nita Ludwig with the Rock Island County Health Department. Go ahead, Nita.
From the beginning of this, the Quad City-wide public health response, Ed and I have talked about how we're a blueprint that we follow at the county level. In the last several days, we have seen the divide between Illinois and Iowa grow. When we in Illinois, Quad Cities must follow what Governor J.B. Pritzker has laid out in his Restore Illinois plan. Even if it's just a few miles away, Iowans are living under a different set of rules. Illinois is taking a more measured, data-driven approach to reopening. We've told you that Rock Island County is part of a region that includes most of the northern and much of central Illinois. The determination of moving from phase 2 to phase 3 will be driven by the COVID-19 positivity rates in each region and measures of maintaining regional hospital surge capacity. It also relies on increased testing capacity and contact tracing. The hospital systems and community health care have increased their testing. But for our part, Rock Island County Health Department is ramping up contact tracing and is reassigning existing staff to take on these new responsibilities. and that is just happening this week. We're all doing what we can to move our region closer to normal. We want businesses to open. We want restaurants to open. The health department doesn't have control over when this happens. You have some control, though. We can move our region closer to normal. If the residents take the messages we've been given for almost 2 months now and reduce your chance of contracting COVID-19 by staying at home as much as possible, and especially when sick, keep at least 6 feet between you and anyone else. Wash your hands frequently with soap and water for at least 20 seconds or use hand sanitizer. Cover coughs and sneezes with a tissue or with your elbow, and wear a face covering when you must go out for those essential trips. Thank you.
Thank you, Ed and Nita. Now we'll hear from Brooke Hendrickx with the Child Abuse Council. Go ahead, Brooke.
Hi, thank you for having me today. My name is Brooke Hendrickx. I'm the Director of Development and Communications at the Child Abuse Council. We're based in Moline, but serve both Iowa and Illinois counties. I'm here to talk about the increased risk of child abuse due to the COVID-19 pandemic. This pandemic, I think for all of us just in general, has created a great deal of stress and anxiety. And in families that were already at high risk, that increases the risk for child abuse and neglect in those homes. Add to that the fact that children are no longer in school or daycare or after school activities or sports, and we just lost all of our mandated reporters. So what many cases of child abuse and neglect may go unnoticed and unreported until school resumes in the fall and families return to regular activities where home visitors can come into the home, and there's other eyes on those cases. If you have spoken at all with DCFS lately or DHS, their numbers and reports have dropped. That doesn't mean child abuse has dropped. It just means the reports aren't happening. So what we really encourage teachers and home visitors and anyone who has even any sort of virtual contact with families to do is to keep an eye on those backgrounds, ask kids how they're doing, encourage your children, especially older children, to talk to their friends about home. Simple comments can come up about, oh, you know, everyone's yelling here. And kids share a lot. We just have to listen for those signs. The Child Abuse Council and its programs are prepared to meet the needs of our community as we begin to heal from COVID-19. Our website, childabusqc.org, has information on all of our programs. We are currently up and running, just remotely. We are still seeing clients virtually. And still doing community trainings just in that virtual environment. So please feel free to email or call us to talk about any services that may be available to you, your family, and the families that you serve. Thank you, Brooke and Janet.
Thank you, Brooke from Brooke. Okay, we're gonna go next to the questions. So we'll invite Ed and Nita to join us again. Our first question that we received was for Ed. What is your reaction to what happened this weekend at Crow Creek Park in Bettendorf? Should people be gathering in groups, and should they be gathering in public places like parks?
Our advice all along has been to get outside and get some exercise, but to maintain social distancing. From the reports I've seen, that likely was not happening. We encourage people to maintain their distance and try to ensure that they don't transmit the virus should they be infectious.
Thank you. Next question. Why are we having just 3 briefings a week? Nita, would you like to start with that question?
Sure. Well, I think, you know, our messages have been virtually the same most every day, talking about social distancing and washing your hands and only going out for essential trips. And those are really the only tools we have at this time, since there is no medication yet or vaccine available. And we have invited, you know, other partners to speak on different topics, just like Brooke is here today. So I think we just felt that, you know, those were the messages that we just keep repeating. And 3 times a week with any changes that happen in each county, we can certainly share in a timely manner.
Ed, would you like to add anything to that question?
No, I think Nita said it well. The only thing that we can, only way that we can have an impact is to tell people to maintain social distancing. So we do it in every press call that we have, but things have not changed much beyond that. And so we decided that 3 times a week is probably sufficient for that purpose, and to allow us to have our guests, such as Brooke and the hospital representatives. And
Thank you. And I know you both continue to answer questions as they come in, as well as being able to be available should we need to on another day in the future. So thank you for that question as well. Nita, we'll start with you with this one. Should people continue wearing masks? The messaging on masks changes almost every day. What do local health officials think about masks?
So in Illinois, our governor has really, in his executive order, he says people should be wearing masks when they go out in public on those essential trips. So in Illinois, definitely that is part of the executive order. And just remember that the face covering is protecting others from germs you may have. And when they wear a face covering, that's protecting you from germs they may have. So if everyone's wearing a face covering when they're out in public, it's a lot safer to be out in public on your essential trips if everyone's wearing a face covering of some kind.
Ed, would you like to add anything to that?
the CDC still recommends the wearing of face coverings.
Nita, can you give us an update on Tyson-related cases if the information is public?
Sure. So I did check that this morning, and there are currently 108 confirmed cases related to the Tyson plant, which I think has been holding steady for the last few days.
Nita and Janet, perhaps you can both answer this last question. Will you continue to send us the updated numbers daily?
I think Janet has been putting out the press releases for Rock Island County case counts on a daily basis.
And I know for Scott County, the numbers that we provide you on this briefing are actually just us restating what the Iowa Department of Public Health has released earlier in the day. And those can be found on coronavirus.iowa.gov. Now that the dashboard has been updated, you can click on Scott County and get a bunch of additional information that might be beneficial for you. So we will not be providing anything separate from when we're just reiterating or restating what the state has already put out when we're on the calls for this. And just to confirm how many deaths in Scott County, and that is 8 for Scott County. If there's additional questions, please. Question for you, Brooke. Could you talk about the number of increased calls that have been received?
Actually, there's been a decrease in child abuse reports. And that decrease is because our kids are not in school and they're not with those other adults that often look out for them and make those reports. Coaches, childcare providers, after school programs, those people have been quarantined from children's lives, so they can't make the reports that they normally would. A lot of this is similar to an increase in child abuse reports that DCFS and DHS receive in September when kids go back to school. I see that happening once kids are able to get back into their regular safe environments outside of the home. I think we'll see that increase in reports. I see the question about quantifying the decrease. I don't know. I would say on just average, there's at least a 20% decrease in calls, but that's just based off of what may have happened.
Okay, seeing no additional questions, we're going to conclude for today. We will be sending you information on Wednesday as well to have our next press briefing. So thank you all for joining us. Thank you for being here, Brooke. We appreciate your time, and be looking for a press release to follow from Janet. Thank you, everybody. Have a good day.
Thank you.
Thank you.